Angela. All right. Good afternoon and welcome to today's Health and Human Services hearing. I'm Councilmember Priscilla Tyson, Chair of the Health and Human Services Committee. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel number 3, and the rebroadcast is available at www.columbus.gov. The subject of this afternoon's hearing is Columbus Public Health's proposal to change the city code regarding wild and exotic animals. Joining us today from Columbus Public Health, we have the Health Commissioner, Dr. Mashika Roberts, Edward Johnson, the Director of the Public Health Policy, Ann Tomlinson, Chief of Neighborhood Environmental Health, and she'll be joining us to help us. If we have any questions, she'll be able to also respond to questions. And our presenter for this afternoon will be Aaron Messer, public health veterinarian, registered sanitarian, and registered environmental health specialist. The changes being proposed today are needed to align Columbus City Code with the Ohio animal laws. Moreover, Columbus City Code, Chapter 2327, concerning animals must be synonymous with application and enforcement of corresponding sections found in Columbus City Health Code, Chapter 243, or nuisance, dangerous, and vicious animals. With respect to animals, it is important that our health department has the legal authority needed to maintain public health and safety of residents, as well as prevent or address animal cruelty when necessary. The proposed changes would remove and replace several definitions. In addition, the city code contains regulations regarding an animal review board and the review board, is no longer an existing entity, so the code must be updated to reflect this. While I am providing general information about the proposed changes, today's presenter will discuss additional details about this proposal. With that, I would like to turn it over to Dr. Roberts to introduce her team.
Well, thank you, Councilmember Tyson, and thank you for this opportunity. As you mentioned, I have here with me Dr. Aaron Messer, our public health veterinarian. I have Ann Tomlinson in environmental health, and I also have Edward Johnson over public health policy. Columbus is very fortunate that we have a public health veterinarian like Dr. Aaron Messer. Today, we are here to present on proposed city code changes that would harmonize Columbus City laws with state laws around keeping of wild and exotic animals to keep our residents safe. These state laws were set in motion after the tragic events in Zanesville in 2011 and have finally come to us. Should City Council approve these code changes today, or should they approve them when they do take them to City Council, they will eventually be accompanied by the City Health Code changes as well. So at this point, I would like to turn the floor over to Dr. Messer, if I may.
Absolutely.
Good evening. Thank you for allowing me to present today. My name is Aaron Messer. I'm the public health veterinarian for the City of Columbus. This presentation will briefly cover suggested revisions to Columbus City Code, Chapter 2327, entitled Animals. It is intended to cover what revisions are being recommended in each section and why such revisions are needed.
We're trying to pull up the PowerPoint. Can everyone see that? Can you see that, Councilmember Tyson?
Yes, I can. Thank you.
Great. Thank you.
We see here the major reasons why revisions are needed. The Animal Review Board is no longer in existence. Columbus City Code and Columbus City Health Code are not in alignment with each other. And passage of Ohio Revised Code and Administrative Code regarding dangerous wild animals and restricted snakes resulted in an automatic vacate regarding such animals in City Code 2327. These revisions will address these needs and additionally ensure an animal owner's right to due process is equally provided in Columbus City Code and Columbus City Health Code. From this point forward, the slides will outline the revisions brought forward. In 2327.01, definitions will be aligned with Ohio Revised Code and harmonized between City Code and City Health Code. In 2327.02, penalties listed in City Code will be synchronized with Health Code. In 2327.03, the intended determination outcomes of the defunct Animal Review Board will be maintained. Enforcement of the determinations will be synchronized between City Code and City Health Code. And finally, in 2327.04, the right to appeal an adverse determination is referred to City Health Code for specifics. Revisions in 2327.05 and 2327.06 harmonize City Code with City Health Code regarding written directions on housing, confining, controlling, moving, and relocating nuisance, dangerous, and vicious animals. These sections also harmonize City Code with Health Code, whereby the Health Commissioner and Public Health Veterinarian can declare animals as nuisance, dangerous, or vicious. Revisions in 2327.07 harmonize the euthanasia or removal of vicious animals from the jurisdiction with Health Code. 2327.08 has been renamed from cost to impoundment. Impoundment is the enforcement action. In 2327.09, the ban on keeping venomous reptiles in arthropods is reenacted, and a ban on dangerous wild animals and restricted snakes, as found in Ohio Revised Code 935, is enacted. In 2327.10, registration of attack trained dogs includes implanting a microchip for permanent identification. And in 2327.13, City Code is harmonized with Health Code requiring cats to wear a rabies tag. 2327.15 completes the updates to City Code, disallowing dangerous wild animals and restricted snakes. As stated in Ohio Revised Code 935.29, local ordinances, a municipality may adopt and enforce ordinances more stringent than the requirements listed in ORC 935, possession of wild animals and snakes. Thank you. That's my presentation.
Thank you, Councilmember Tyson.
Thank you, Dr. Roberts, and thank you, Dr. Messer. We do not have any public comments for this hearing. We sent out the notice, and no one submitted any, or no one asked to join this meeting today. And so I thank you for your presentation. As legislators, we try to be proactive in understanding our community and the policies that needed to allow residents to thrive while also protecting public safety. However, there are situations that occur in a community that prompt policy changes. The unfortunate incident that occurred several years ago in Zanesville, Ohio, in which private zoo animals were released into the public, jeopardizing the safety of the residents and the animals, resulted in changes to our state law. We are now taking this opportunity in Columbus to harmonize our city code with our state law. And so I don't have any questions. I think it's pretty self-explanatory, and I appreciate Director Dr. Roberts and Director Messer for the presentation. So before I conclude this afternoon's hearing, I want to thank Health Commissioner Dr. Mashika Roberts, excuse me, Edward Johnson, the Director of Public Health Policy, Ann Tomlinson, the Chief for Neighborhood Environmental Health, again, Dr. Messer, the Public Health Veterinarian, Registered Sanitarian, and Registered Environmental Health Specialist, and my staff, Nicole Harper and Carl Williams, the hardworking team of CTV who make these hearings possible. I also want to thank Angela Burks and Mark Carter for help for making sure now these hearings are available for using technology to make sure our residents can see that we're still working during this period. But most importantly, I want to thank the residents of Columbus who allow us to do this work each and every day. Thank you for joining us for this Health and Human Services Committee hearing, and we are now adjourned. Have a good evening. Thank you.
Thank you.
Thank you.